740 News Radio 102.9 KARN. Cam Patterson is with UAMS. Good morning, Cam Patterson. How you doing?
I'm fine, Kevin. How are you doing this morning?
Doing fantastic, and thank you for being on. What's happening with UAMS involving what's taking place there with coronavirus testing and just the virus in general? An update, if you would.
Yeah, it's been a busy week. You know, we have a drive-through COVID-19 triage and screening and testing service that people utilize. We had 3 lanes going last week. We had 6 lanes going yesterday. So the number of people who are concerned in central Arkansas about COVID-19 infection has clearly gone up after the July 4th weekend.
What is the wait time for that? I mean, it doesn't sound like you're just jumping in and out to get your, fast food burger when you're waiting in that kind of a line. So what are you looking at there if you show up?
Yeah, our teams are working super hard, but people are lining up, an hour or more before we even open. So, at the height of the middle of the day, it can be an hour or more wait time, which is, the fact that people are willing to wait that long to get tested just goes to show the amount of concern that exists in our community.
Yeah, Cam Patterson with the UAMS. There may very well be people that are hearing us talk about this, and they want to get tested, but they don't know the specifics of the site, where it's located, what they need to do, cost involved. If you can give some basics on that, it'd be fantastic.
Yeah, if you come to the, the main UAMS campus on Markham, there are signs on either end of our campus that will direct you to where you need to go. Your insurance information will be taken, but there's no out-of-pocket expense to get tested at all.
Very good. Cam Patterson, he's Chancellor at UAMS. What about those tests? I mean, the results, are you seeing a lot of positives there, or are you able to tell?
Well, the positive rate that we see is a little bit less than 5%, which is about what you want to see. That's about the right number. It tells us that we're screening the appropriate number of people. Obviously, across the state, as you look at the number of infected individuals, we had over 700 new cases in the state of Arkansas yesterday. So the numbers continue to rise. It's a concerning situation. And our projections are that those numbers are going to continue to rise up to around 100,000 active cases in the state of Arkansas by late September, mid-October.
So what do we need to do? I mean, that's an outstanding number there. Is the mask wearing and social distancing, can that maybe curve that prediction down a little bit?
Yes. Those numbers are based on nothing changing. But if we get to 95% compliance with mask wearing and social distancing in public spaces, that will substantially reduce those numbers by about 2/3.
Cam Patterson with UAMS. What about the testing supplies? Have you got plenty of that?
I would say we have fairly adequate supplies for testing. We're frequently challenged with the reagents that we need. We could be doing more testing if we had more reagents, but frankly, there's no mechanism at the national level to distribute those reagents in an effective way, and so we're in fistfights with other states for the reagents that we need for testing for COVID-19.
If there's a fight, I got your back. No worries. No worries. It's Cam Patterson with UAMS. Curious about this, too. There's some conspiracy theory out there now that talks about how you get this test, and they go with a swab more towards the back of your nose, and it's supposedly to put an implant in you, which you and I both know it's not true. But curious, why is the test done how it is as opposed to like something where they swab your mouth or something?
Yeah, the reason is the reason that the testing is done in the way it is that the virus colonizes the sinuses in the most posterior or furthest back part of your nasopharyngeal area. So to get to it, you've got to push the swab all the way in the back. If you don't do that, you're likely to have a false negative test, which would give you the impression that you don't have the virus when you might actually have it.
All right. So there's no brain implantation going on there, correct?
That's correct. It would take a neurosurgeon to do that, and we're not all neurosurgeons.
Yeah, well, I don't know. My mind's a little hollow, so you never can tell. We're hearing about, the situation, ICU beds and space to keep patients that are coming down with coronavirus. Not only that, but people who have typical issues, too. And that's why some of these hospitals get overwhelmed. What about at UAMS? What's the situation there?
It's fluid. We were on what we call ICU Max late last week, which means that we had few or no ICU beds available. It's a little bit less tight this week. We're still fairly early in the week. We tend to get fuller towards the end of the week. So we're watching it on a daily basis. I think right now we're okay. We know that a couple of weeks ago the hospitals in Northwest Arkansas were overwhelmed. So that situation can change. And certainly if the number of hospitalized patients in the state continue to rise, and they seem to be rising every single day, we're going to reach a point where we are stretched thin.
All right. We'll keep updated. Cam Patterson, Chancellor at UAMS, good to have you on this morning. Thanks so much.
Thank you, Kevin.